You've dislocated your shoulder. Maybe you fell. Maybe you lifted something wrong and felt it pop out of the socket. And now your arm is hanging at a wrong angle, useless, and the pain is intense enough to make you nauseous. You need someone to put the joint back in place. But there's no ambulance, no emergency room, no doctor. You're alone, and the longer the joint stays dislocated, the more damage occurs. Muscle spasm, tissue swells, blood supply is compromised. What starts as a simple dislocation becomes a complex injury requiring surgery if you wait too long. In a grid-down scenario in a remote location, you need to reduce it yourself. During the Viking Age and throughout the medieval period, dislocations were common: combat injuries, farm accidents, falls. There were no hospitals, but there were bone setters, people who knew how to reduce dislocations and set broken bones. Their methods were based on experience, leverage, and mechanics, techniques refined over generations, and they worked. Today, those same techniques are used in wilderness medicine when advanced care isn't an option. First, a critical warning. This is for emergency situations where medical care is unavailable. If you can get to a hospital, do that. Professional care is always preferable. Attempted reduction can cause additional damage if done incorrectly, but leaving a joint dislocated for hours or days causes worse damage. In a true emergency, the attempt is worth the risk. A dislocation is when bones are forced out of their normal alignment. The ball comes out of the socket. The joint stops working. Ligaments tear. Muscles spasm violently to protect the injury, locking it in place. To reduce it, you must reverse the mechanism that caused it. This requires overcoming that muscle spasm. Medieval bone setters didn't have muscle relaxants. They used positioning, traction, and leverage. The key principles are steady, gentle traction to separate the bones and manipulation to guide them back in. You're not forcing the joint, you're coaxing it back while the muscles fatigue and relax. Let's start with shoulder dislocations, the most common. The shoulder is a shallow ball and socket joint, giving it great range of motion, but also making it prone to popping out. Most dislocations are anterior, meaning the ball moves forward and down. The shoulder looks deformed with a bulge where the ball is sitting in front of the socket. The arm hangs limply. The medieval method is called the Hippocratic method. The injured person lies on their back. You, the bone setter, sit next to them on the side of the injured shoulder. Take off your shoe and place your foot in their armpit. Not on the chest, but in the armpit, against the torso. Grasp their wrist and forearm with both hands and apply steady traction, pulling the arm straight away from the body. At the same time, push with your foot, providing counter-traction. You are using leverage. The pull creates space between the ball and socket. The foot acts as an anchor and helps guide the ball back in. As you maintain steady traction, you gently rotate the arm slightly, feeling for the position where it will slide back into place. This can take a minute, maybe two. You maintain pressure. The muscles gradually fatigue. Suddenly, you feel a palpable clunk or pop. The deformity disappears. The person experiences immediate relief from the severe pain. Another method is an adaptation of the Stimson technique. The person lies face down on a table or bench with the injured arm hanging freely. Attach a weight to the wrist, 5 to 10 pounds, a rock, a water container. Gravity provides traction. Over 10 to 15 minutes, the muscles fatigue, and the often slowly reduces itself. It's a gentler method that medieval bone setters would have used by having someone lie on a bench holding a heavy object. Finger dislocations are common and easier. They usually happen when the finger is bent backward forcefully. The technique is straightforward traction. Grasp the tip of the dislocated finger and pull straight along its length. At the same time, use your other hand to push the base of the bone back into position. You'll feel a pop as it relocates. The muscles are small, so traction overcomes the spasm quickly. Afterwards, immobilize it by buddy taping it to an adjacent finger for a week or two. Elbow dislocations are more dangerous. Major blood vessels and nerves run right by the joint. Leaving an elbow dislocated is dangerous, but so is a clumsy reduction. The most common dislocation is posterior, where the forearm bones are displaced backward. The elbow is locked, looking deformed. This requires two people. One person holds the upper arm for countertraction, the other grasps the wrist and applies steady traction. While pulling, they gently push the prominent bone at the back of the elbow forward, guiding it back into position. When it reduces, there's a definite clunk. Immediately check that the person can feel their hand and has good circulation. Jaw dislocations happen when the mouth opens too wide, a yawn, a large bite. The jaw locks open. The person can't close their mouth or speak clearly. The technique is simple but requires care. The person sits, you stand in front of them. Wrap your thumbs in cloth to protect against being bitten. Place your wrapped thumbs on their lower back molars on both sides with your fingers gripping the outside of the jaw. Push downwards on the lower molars while simultaneously pulling the chin forward and upward. This guides the jaw back into its socket. It relocates with a pop. The wrapped thumbs are critical because when the jaw relocates, it snaps shut with incredible force. After any reduction, the joint is still injured. Ligaments are torn. It will be swollen and unstable for weeks. Immobilize it. For a shoulder or elbow, use a sling. For a finger, buddy tape. For a jaw, a soft diet for several weeks. Apply cold if you can, snow or cold water to reduce swelling. Limit movement for the first few days, then begin gentle motion to prevent stiffness. A dislocated joint is always more likely to dislocate again. Historical evidence from battlefields and Viking sagas shows these techniques were successful. Army barber surgeons and village healers reduced dislocations in the field, allowing people to recover. The techniques work because anatomy and physics haven't changed. Of course, reduction hurts. Medieval bone setters didn't have anesthesia, but the pain of reduction is temporary. The relief when the joint relocates is immediate and profound. The severe pain of the dislocation vanishes, replaced by soreness. This is a critical mindset shift. We assume serious injuries require professional intervention, and they do when it's available. But humans treated these injuries for thousands of years. These were not primitive methods. They were effective techniques developed through experience. In a scenario where modern medicine isn't an option, knowing this can mean the difference between recovery and permanent disability. You're looking at a dislocated joint. No ambulance is coming. You have a choice. Do nothing and accept increasing damage, or attempt a reduction using proven techniques that have worked for centuries. The anatomy hasn't changed. The physics haven't changed. The techniques still work. This isn't playing doctor. This is having the skills when the doctor isn't available. That's the difference between helpless dependency and practical capability.